Hi everybody, welcome to session 8. This session will be focusing on nutrition. Please don't forget to press like and subscribe. Hi everyone, welcome back to session 8. We'll be talking about nutrition. Now, this session is not just focused on people with chronic pain, rather it's everyone that would benefit from adequate nutrition and food that is not processed and fast food. So just to start off, obviously the less food that you eat that's nutritious, the more fatigued you are, the less energy you have, the less healthy you feel, the less inactivity you resort to. Now, people who have chronic pain are already, again, dealing with pain on a regular basis. If you add on top of that lack of nutrition, you're just asking for more stress and more pain. That cycle, the vicious cycle of increased pain through stress, lack of sleep, and lack of nutrition, all encompassed together, are manifested upon a lifestyle that is not really adequate in terms of dealing with chronic pain. So in order to have less pain, in order to be able to deal with the pain more effectively, being cognizant of what you're consuming is of most importance, paramount importance actually. So often people who have chronic pain, I've heard in my practice, they complain about not having the energy, not having the stamina to actually prepare nutritious meals on a regular basis. So that lack of energy and that fatigue is an impediment with respect to being able to eat more healthy. So for example, if you have a week's worth of food that you have to think about, probably talking about it or figuring out a plan or actually sitting down, running a list of things you need to buy, meal prep, organization. You don't have to do this 5 days a week, maybe a few times a week, 2-3 times a week, where you actually have a plan in your mind of what you are going to make. Can also save you a lot of time. But that meal prep, if you want to eat healthy, you kind of can't get away from it. It's got to happen to some extent. They don't have to be elaborate meals, but they do have to contain some nutritional value at the end of the day. Eating fast foods, processed foods, foods high in sugar and fat often happen when people don't have the energy to make nutritious meals. So you just resort to whatever it is because you're tired. Often I find that even if you're going grocery shopping and you're hungry, you tend to buy things that not only do you not need, but they may not necessarily be choices that you'd be making if you weren't hungry. So again, planning or being cognizant beforehand of what you need could help prevent this thing from happening, where you're buying things that are really not conducive to your treatment plan that your doctor has devised for you. So in conjunction with your nerve block injections, if you're receiving any, in conjunction with your medication, your exercise, your sleep, stress management, and nutrition, all work together in order to help you cope better with your pain. So often I find people complain that they're hungry, they want to grab something that will be satiating in the moment, satisfying. You find that sugar tends to have that aspect of it. So if you're really hungry, you have something that's sweet, in the moment, it feels really good. You feel full, you feel content. The problem with that is that sugar contains empty calories. So while you are feeling content and satiated for about half an hour, those are empty calories that turn into fat, and they absolutely have zero amount of energy. So if you're eating a donut because you're hungry, you're going to be hungrier, which means you're also going to be eating more. So now you have zero nutritional value and high intake of sugar. So staying away from sugary foods or sugary treats when you're hungry is important, because also those sugary treats on an empty stomach can also lead to acid reflux later on and increase acid in the gastrointestinal system as a whole. Chronic pain patients as well, there are a lot of people who are taking different kinds of medications. Some people are not, but some people are. Now, for people who are taking medications, it is fundamental to be even more cognizant of what you're consuming with respect to food and nutrition. A lot of these medications may not be suitable to be taken on an empty stomach. So if you're taking food, if you're taking medication on an empty stomach, or you're staying hungry, or you're eating food that's really not good for you, again, it tends to affect your gastrointestinal system. So you're already dealing with pain. By not being aware of what you're putting into your body, you're also going to be creating additional issues like gastrointestinal issues that can be very uncomfortable and difficult to treat. Excess weight. So there is no dispute, zero dispute, I think. In fact, I'm certain there are no medical health conditions that are ever improved with excess weight. In fact, all medical health conditions are exacerbated by excessive weight, and some conditions, such as cancer, heart disease, and diabetes, are caused by excessive weight gain. So if you're having chronic pain, and let's say you're also already dealing with a weight issue, if you're eating in the way that you're going to be gaining more weight, you're just going to be increasing your pain. So for example, if someone has chronic knee pain and they are overweight, the most important thing for them is to be cognizant of their weight and to lose weight. The more weight is on, the more pressure is on the knee and the more pain is on the knee. So again, nutrition and weight management, you really can't get away from. It's essential, it's fundamental. Also, the more weight you have on you, the more overweight you may be, the less active you are. The less active you are, the less energy you have. The less energy you have, the more lethargic you are, and so on and so forth. So you're not really doing anything in terms of promoting your own wellness and coping with your pain. So increased weight also affects your level of anxiety, your overall mental health, your self-esteem, your self-confidence, how healthy you are on a regular basis. Now thinking if you don't have diabetes or if you don't have heart disease, by kind of letting go of weight management, by not being cognizant of what you're doing, you could be introducing new problems into your life. And diabetes, once you're diabetic, that's it, you're now diabetic. So, and diabetes also has many other complications that are also not reversible. So being very conscious of your consumption of sugar, fatty foods, and processed foods is of utmost importance, fundamentally. It can make a difference in your level of energy, your exercise, your pain, all encompassing. Again, natural sugars. Now, people are going to argue that, well, I have honey or I have brown sugar. While honey is a natural sugar, again, the key here is moderation. So if you're sitting and having spoonfuls of honey, it doesn't benefit you. Yes, it's a natural sugar. However, it should be consumed with moderation. Yes, it's better than processed sugars. Yes, it's better than diet sugars. Yes, it's better than white sugar. However, the key is moderation and portion control. So if you're having a cup of coffee, you might want to not add the honey. You might want to have a little bit of cream as opposed to the sugar. Or if you're going to have the honey, maybe just put half a teaspoon to start out. There's got to be some sort of a plan that works for you that you can sustain on a long-term basis. Avoiding trans saturated fats. So again, these are deadly and major contributors to heart disease and diabetes and cardiovascular disease as a whole. So processed foods like cold cuts, again, fast foods, foods that are not fresh, foods that are packaged, foods that have additives and preservatives in order to preserve them, are not going to be foods that you want to be consuming on a regular basis. Again, I'm not suggesting that you should never consume such foods. If you're doing it 5 days a week, there's a problem. However, if it happens once in a while, maybe once a week, you're having a cheat day, I guess, everything in moderation is acceptable. However, just being conscious of the amount that you're consuming is also important as well. So avoiding processed foods. Again, one other thing that people I find often talk about is if you're having a really fatty meal and suddenly your concern is, well, I'm going to have a diet sugar in my coffee. The diet sugar is not your problem. The problem is what you're actually consuming. So again, diet sugars are not necessarily the best choice. Again, if you want to have diet sugar, you can. However, diluting yourself to the fact that this is good for you might be something to look at. So maybe avoiding sugar altogether, or again, switching it up with brown sugar or honey might be a better choice. Coffee. Now, coffee is a natural antioxidant and an anti-inflammatory agent when consumed in moderation. Again, some studies have also suggested that it prevents certain cancers as well. Now, regardless, if you're having 5 cups of coffee a day, you're not going to be attaining any nutritional benefit. In fact, you're going to be introducing now insomnia, hyperactivity, and perhaps heart palpitations. So again, consuming in moderation, generally 2 cups a day, depending on, the person. Some people have maybe 1 cup a day, but no more than 2, and possibly in the afternoon, nothing after 3 p.m. because it tends to affect your sleep and overall cortisol levels that need to be lowered by the time you want to go to sleep. So again, coffee, moderation. Again, if you're adding, a truckload of sugar to your coffee, you're negating any beneficial quality that coffee can have. So being cognizant of sugar and toxicity of sugar is extremely important. Alcohol consumption. Now, alcohol affects the neurological system, the vascular system, the respiratory system, and major organs in the body. It can also cause weight gain and contains sugar. Now, having said all of that, again, I'm not suggesting that alcohol should be avoided completely. Alcohol should be consumed in moderation. Again, moderation, depending on, weight and whether, you're a man or a woman. Now, also though, as a disclaimer, if you are taking medications for your chronic pain, it might not even be appropriate to be consuming medications in conjunction with alcohol. Again, consulting with your physician with respect to alcohol consumption might be also something to look at and be important in the long run. Again, moderation, proportion, control is key. Again, some recommendation with respect to nutritional value: having a high protein diet and a low carb diet. So if you're having a meal and about half of your plate is rice or pasta or bread, it's not really the best choice. Whether if you have half of it is, vegetables, and then you have some protein, and perhaps smaller amount of carbs would be beneficial in terms of weight and overall health management as a whole. So you're going to promote weight loss with respect to that kind of a diet, preserve muscle mass. Now, especially for women who are at risk of osteoporosis, preserving muscle mass is crucial. So engaging in strengthening weightlifting exercises is very important. Being cognizant of your overall muscle mass, whether you're getting any bone density assessments throughout the year, are also something to consider. Improving your blood sugar. Again, sugar I keep mentioning is something to be cognizant of at all times. Lowering your rate of heart disease by not consuming processed foods on a regular basis. Also preventing your chances of contracting diabetes is also important. Again, enhancing bone health, osteoporosis, muscle mass, strengthening, weightlifting, all go together. Improving mood and energy levels. Generally speaking, if you are overweight, you tend to feel lethargic, you tend to feel more fatigued and more tired, and therefore you're less active. However, increasing your exercise, which I'll be talking about in the next session, the importance of exercise, will not only help with mood, but also with weight control, with pain management, and overall health. Eating fruits and vegetables on a regular basis. So throughout the day, not to sit at night and have an apple, an orange, and a plum, but perhaps kind of dividing that throughout the day on a daily basis. So provides essential nutrients, minerals, vitamins, antioxidants that are important. These all have to happen they should ideally be happening on a regular day-to-day basis. Let's see, eating fish, we're looking at omega, again, salmon, trout, whichever you prefer. There's got to be some sort of omega in your diet. If you're taking supplements, I guess it's fine. However, actually eating fish and salmon in your diet, incorporated 2 to 3 times a week, would be extremely beneficial. Eating red meat should be limited to twice or once a month, possibly, if possible, Red meat is important for iron, but again, we need to think about the amount of consumption and the portion of consumption. So if you're having, 3 steaks a week, that might be problematic in the long run. But, maybe 1 piece of steak a week or every 2 weeks is not really consequential. So eating legumes, which provide fiber, protein, beans, complex carbohydrates. We're looking at complex carbohydrates that can be acquired through grain products, not processed simple carbohydrates like French fries and white bread. These are huge contributing factors to weight gain. So while you need the fiber, looking at the whole grain, the whole wheat is important when you're trying to choose when you're trying to choose breads and cereals and whole grains. So eating nuts on a regular basis, again, they provide calcium, energy, essential fats. Again, I keep re-emphasizing portion size. So if you're having a large bowl of nuts a night, that might be a problem because you will gain weight. However, a small amount, a fistful of nuts is beneficial, can be beneficial in your diet as well. Eggs in moderation, B12 and protein, fundamental. Again, you might want to opt for hard-boiled eggs as opposed to scrambled or kind of alternating back and forth, so you're not just consuming scrambled eggs with oil. Again, we talked about coffee. Essentially, all encompassing, being cognizant of what you're consuming on a regular basis, meal planning, keeping things to a moderation. Again, we're not saying don't ever eat McDonald's, but maybe not eating McDonald's every day would be beneficial. At the end of the day, if you're trying to lose weight in conjunction with having chronic pain, looking at your input versus your output is fundamental. So if your input, what you're consuming, is greater than your output, your exercise level, you will gain weight. So if you're going to exercise, but you're also having, really unhealthy food, your exercise is negated. It just doesn't work. So being aware of what you're consuming, how much you're consuming, and how often. Thank you. Please don't forget to press like and subscribe. Next session, we'll be working on exercise.